Okay. All right. I'm Paul Kirby, a reporter with the Daily Freeman, and I'm here today at a live stream event in the Daily Freeman offices. With us is David Scarpino. He is CEO and president of Health Alliance of the Hudson Valley. And with him is Josh Ratner, who is the chief strategist for Health Alliance of the Hudson Valley. And they're here to talk about among other things, expansion plans that they have planned. They were recently announced a few weeks ago. They are here today to maybe get some more specifics. Talk to us about the plans at Mary's Avenue, formerly Benedictine Hospital campus, and at the Broadway campus, formerly Kingston Hospital, where the plan is to establish a medical village. But they will get into all that right now. So, Dave, if you want to start, I guess you could
Sure.
just start with the general concept here, and what the plans are.
Sure, be happy to. Thank you, first of all, Paul and the Freeman for having us. I think this is a unique opportunity for us to be able to talk to the community about our plans because they're very wide-reaching, and I think what we're going to be doing is very different in this community. So let me just lay out the two pieces. Number one, we do, as you know, we have two hospitals, and we want to consolidate those two hospitals into one facility on the Mary's Avenue campus. What I want to make sure that everybody understands is that we'll be bringing all the services we currently provide in both campuses into the one campus. What we will be doing, we will be reducing the number of beds from 300 beds, 150 in each hospital, to about 201. And the reason we're doing that is we've experienced a decline in admissions over the last couple of years. And if we continue to progress in the way we deliver healthcare, our job is to keep people out of the hospital. So our census should go down. That's a sign of success for us. So how do we keep our census down, and how do we keep people out of the hospital? We keep them healthy in the community. And then that speaks to the healthy village, or medical village as some call it. And that's the conversion of the Broadway campus into a healthy village, where we will collaborate with community providers in a way that treats people before they get sick, that brings together the Institute for Family Health, who do primary care predominantly for the underserved and Medicaid population, and linking that with our behavioral health services.
That remains the objective, right?
That remains the objective. It's a very strong
to
objective.
serve lower income people.
People
right?
with both primary care issues and behavioral health issues. I saw a statistic today that said that 21% of patients have behavioral health problems in the state, but 60% of the resources are consumed by those patients. So how do we effectively treat them collaboratively? How do we pass off the care from one provider to the other? Those will be the two anchor tenants in the medical village or healthy village, but then there'll be collaborative partners, which we'll get into. Other folks in the community who provide care, who see the patients that come to see us as their patients too.
This, I've been told, is a unique concept, right? For I guess for in the country, I suppose, but at least in New York State, is that right? I mean, it's are there other medical villages that you know of that are in or one-time hospitals?
Yeah, so if you look at the medical village concept, as the states described it as part of their reform program called DISRIP,
Right.
there were roughly 20 projects that applied for the medical village.
There were. Okay.
And we are the most substantial medical village out of those 20. We're the only ones in New York State that applied for repurposing and redeveloping a hospital to serve outpatients in its entirety. So what we're talking about is converting an inpatient hospital today into a medical village for tomorrow.
Okay.
We were the only ones in the state that really applied for that.
Did that kind of building plan
Correct.
With a former hospital?
Correct.
The other ones that applied just wanted to build a new,
Yeah, most of the other ones we're talking about taking a piece of a hospital. For example, they'll take a floor and convert it from inpatient services to outpatient services.
Okay.
Or take a part of a building and convert it into outpatient services.
Okay.
I really think the next substantial medical village, other than the one here in Kingston, is the other one that Westchester Medical Center Health Network is developing in Port Jervis. So they're also talking about redeveloping a building into a medical village as
A
well.
whole hospital?
Not a whole hospital.
A building on a campus somewhere?
Correct.
Okay. Okay, so why is it that these are coming, these are starting to pop up, or suggestions of these are starting to pop up? Is it, I mean, it seems like, and we talked about this before, Josh, I think that, that we need to do better in serving that underprivileged population. I mean, is that why these medical villages are suddenly becoming ideas?
Yeah, I think, yeah, the major push is to really begin to look at treating patients proactively rather than waiting for them to present to us in the emergency room or, in another type of urgent setting. It's really to begin to continue to work with those patients on an outpatient basis and build what we like to refer to as an ambulatory perimeter of outpatient services, so that rather than waiting for you to have a critical condition, if we can continue to work with you to remain healthy, then you're happy because you don't need to come into the emergency room or be admitted to a hospital. It keeps costs down and it improves quality of life and costs.
Why can't we do that now without a village?
So I'm just going to go there, and
Yeah.
it's really driven by the collaboration between the payers and the providers. So right now we're in a volume world, and by volume I mean that payers, Blue Cross, Medicare, and to a large part Medicaid, still pay us on procedures. So if you come into the emergency room, we get paid. If you come in for a diagnostic test, we get paid.
Okay.
That's volume driven.
Okay.
So we're reactive to when you're sick or when you need care.
Okay.
When that payment system moves from volume to value, where we're then measured on successes, keeping people healthy, using metrics, using data to say, you know what, by doing these preemptive and proactive initiatives,
Mm-hmm.
we're keeping people healthy and we can measure that success, we'll get paid based on that value. But the payment systems and the care delivery have to be in step. And
Okay,
right
so-
now, the driver is Medicaid in the state. We have some programs in the commercial line, but not a lot. Medicaid tends to be more punitive, that if your readmission rate is high, we will pay you less money.
Is
So
that
they do it
right?
more punitively. But it'll grow when people see that there's value.
Okay, so if less people are coming to the hospital,
Mhm.
the more you get reimbursed. Is that right?
There'll be counterbalancing payments to us,
Yeah.
to be able to provide preventive care.
Okay, so that's one reason why you would want to establish this medical village,
Right.
right? To have, which you don't have now, but to have people like Family Institute and other ones that you will get in a building all of its own, right?
Well, and as you look,
And to better serve, to keep people who have Medicaid from having to go into the hospital.
In this initiative, that's correct. But generally, the population we serve, we've looked at some analytics from a few years ago, and if we had a different care delivery model, 50% of the people who come to our emergency department on an annual basis, that could be avoidable if we had a different way to treat them in the community. Right now, that doesn't exist. And it's our job to work with the community to try to change that delivery model.
Okay.
So for instance, and I'll give you a Medicare example that I use often.
A Medicare example?
Medicare example.
Yeah, okay.
Somebody who's elderly, like me.
Yeah.
So for instance, if I have congestive heart failure,
Yes.
and I'm in my home, and if my heart starts to behave in a way that is, dangerous to me and doesn't work efficiently, I'm going to retain water. And one of the signs and symptoms of that is you gain weight. So imagine a world where you've got one there and I've got one here.
Yeah.
Where you use your smartphone, that maybe you get on a scale every day and you weigh yourself. And that goes into our care coordinators, a different type of job than we have now, who monitor that and see the progress of that and maybe call you up and say, Dave, call me in. Dave, we noticed that you're having a little bit of a trend of weight gain here.
Yeah.
It's not around the holidays. We're going to make an appointment for you to come and see your doctor.
Okay.
If we can intervene before they come into the ED,
yeah,
isn't that better? The quality of life improves, the cost of healthcare goes down, it's a better system.
And the way to coordinate that is through this establishment of this medical village. Somebody, those caregivers that you're talking about would be part of this, because this isn't the first time you've talked about this kind of thing. I mean, back in 2013, I think remember there was a press conference or something,
Yes.
and I think you talked about doctors actually making house calls.
Well, it's talking
And you
about
called
this
population growth.
population health
Right.
management.
Yeah,
It's
yeah.
exactly that's the really the industry term for what Dave just described with his iPhone.
Yeah.
But what we're saying is we need to be able to integrate care across multiple care settings. The medical village is one care setting, and it allows for us and for anybody who's developing a medical village to repurpose hospital infrastructure so that it's useful for the community to accomplish the goals that Dave just described to keep the community healthy. But that's not the only way. I mean, certainly part of what we're trying to do in our industry as a whole is begin to share information, whether it's through your iPhone or electronic health records, in order to really help maintain and improve outcomes. It's the one physician practice speaking to another physician practice using that data and that information to help manage that patient.
Well, how do you get patients to to speak about that kind of information? You know what I'm saying? I mean, people today are not trusting of like computers and things, and it's sort of like a big brother thing. How do you convince people that this would be a good idea for them to do?
Well, I think most people don't want to spend time in an emergency room or a hospital if they don't have to. So really what it starts with is addressing those patients who are the most at risk for being in an emergency room or a hospital.
Uh-huh.
If you're somebody who has diabetes and you have heart failure and you have other ailments that are wrong with you, and you've come to the emergency room multiple times, if we can sit with you and say, hey, there's a way that we can work with you proactively so that you don't have to come back. They may not love the fact that they have to share some of that information,
Yeah.
but the trade-off is there's a cost benefit, and the benefit is not having to be admitted.
Right.
So you really start by working through chronic diseases, as Josh described. So whether it's hypertension or it's diabetes, it's smoking, it's drug abuse, it's obesity. How do you then talk to the folks who suffer from those chronic conditions and convince them that by working together, we can improve the quality of their life?
So is all of this the healthy neighborhood, or is that something different? The healthy neighborhood initiative.
So
Go ahead.
yeah, so the Healthy Neighborhood Initiative is what we've packaged as really the revitalization of Midtown. If you begin to look at the amount of capital being spent to change the face of the community, you have on one campus our new hospital that's being redeveloped on Mary's Avenue.
Right.
Right across the street, you now have the new SUNY Ulster Community College, the Extension Campus, which was a redevelopment of the elementary school. Very
Right.
similar to the demographics changing and no longer needing an elementary school and redeveloping it into something that's useful for the community.
Something that's different.
Consistent with what we're talking about in Medical Village.
Right.
Behind it is the new high school that's being developed and all of it changing and really developing with our community. And then behind that will be the Medical Village. So what we're talking about in the Healthy Neighborhood is really to begin to create a walkable campus. Whether you're a student or a community member or an employee or a patient, you can begin to look at the entire the entire project as an opportunity to educate our community members, to redevelop our workforce, to improve our own employees' skill set, and to help keep our own patients healthy.
So all those things that you mentioned in this healthy initiative are like a big picture thing. It's all together.
Yeah,
You envision this as being all sort of one thing.
That it's easily accessible in one location. So for instance, if you come in and you have diabetes or obesity, part of what you're going to be looking at is exercise programs, maybe alternative medicines in terms of yoga, meditation, acupuncture. You're going to want to learn how to eat healthy. Maybe there'll be some cooking demonstration, maybe access to healthy foods from the farmers locally. Bringing those together in one location
In the medical village.
in the medical village with Healthy Village allows you then allows the patient to easily seek them out. Because sometimes, you leave your doctor's office and the doctor says to you, you need to eat better. And you go, uh-huh. And you have to go out and then find that. If we can bring it to the people and then
Be right
teach
there. It's
right
convenient. It's something about convenience as well, right?
Yeah, but it's not just about what happens in the four walls of the village.
Okay.
This is really important. It's really about what happens in the entire area and the community. So it could be that you come into the medical village and you need to get healthy foods, or maybe you're a part of a workforce program, or you're getting care. But it could also be a student who goes to the high school who rotates through one of our departments because they're interested in becoming a nurse or a doctor. It could be community college students who are looking to continue their education and hopefully would like a position in the hospital when they come out. So it's developing
And
workforce
so what do they
collaborators.
do? What does that person do? Go to the medical village and get advice on,
No, so again, the Healthy Neighborhood Initiative
yeah,
is all of those campuses.
okay,
It's really one area. So if you are an employee of ours today and you have a
yes,
goal of going back to school to become
y-
a nurse, for example,
yes,
can we work with the community college or others, SUNY New Paltz,
to get that person enrolled.
to get them enrolled, and maybe they're going to walk across the street to the campus and be able to go after work and
Okay,
attend classes.
okay.
That's just as important as being able to go into the healthy neighborhood, into the medical village, and being able to see a physician.
Same with the high school kids.
Same thing with the high school kids. So today we have the New Visions program, where we have some BOCES students who rotate through various departments. Can we expand that and work with PTech and others?
All right, so
to
it's
develop-
kind of a reaching out to the general area, you know?
Right. Instead of us working alone,
Yes,
when you think of the old style hospital, you came to it when you needed it, you left it, and that was the last
was
you
it.
heard of it. We want to be part of the community, and we want to be an integral thread of the community where we're working with partners. That we're not doing things just by ourselves, whether it's the educational factors, the medical factors, even the community social. How can we help people in this community
okay,
thrive?
and that's what makes this different, it seems to me.
Yes.
But maybe you can explain that then places with all the things contained, like over in the town of Ulster, that medical building over there, where they do have all different, you know, specialties and things in one building. How is that? How is your medical village different than that kind of thing?
Well, in the basic concept, you're correct. They have all of the services under one roof, but most of it is a single provider. It's one physician practice for the most part. There are others, but for the most part, it's one provider. What we're talking about is having multiple providers co-located under a single roof.
What's the wait, no, because over there they have a bunch of different things. I mean, it's not just one. What do you mean when you say one provider?
So you have CareMount, right, which is
That's the company that owns the whole building.
right,
Right.
and fills a good part of that building.
Yeah, with
with
different types of practices.
Correct,
Yeah.
and different types of services.
Yes.
All part of the same group.
Company group.
Right. And
Which is what no, what's different with yours is that they won't be. They're actually the only connection will have with HealthAlliance is that they're in your building.
right. So it's like a medical mall where
Yeah.
you can have a physician provider who's not part of HealthAlliance, probably won't be part of HealthAlliance, like the Institute for Family Health, who could be who is located in the building, and right next door you could have maybe a county service or another community-based organization providing services. It's really the collaborative of the multiple providers working together so that you have the convenience of being able to come in
Right. Okay.
and get all of your healthcare needs taken care of at one location.
But even some of your community needs taken care of. Josh alluded to it slightly. If you have county services, so say you maybe have a senior citizen center there, maybe you've got housing or daycare or transportation. So you're really complementing what we do and making sure that everybody gets what they need. When a patient leaves the hospital, we have to make sure that they go to the pharmacy, they get their medication. We have to call them regularly to make sure they took their medication. We want to be there to help them become healthy.
And that's part
That's
of
the
the
difference.
initiative. That's the difference. And you're a target audience, or maybe I shouldn't say that. Target clients for this medical village are the underprivileged. I mean, at the other buildings, I mean, they're not. They don't have that sort of theme going on, right?
Well,
At the ones like at the town in the town of Ulster. I mean, you guys have a certain. There's
Right,
a mission here.
Our
right?
mission is the community at
Yeah.
large. It's
Yeah.
not just limited to a particular segment of the population.
Okay.
The piece of this is starting to be driven by Medicaid, by the
Yes.
state. But
Yeah.
this is broader than just Medicaid. This is our entire population of the city.
Okay.
So whether it's Medicare, whether it's commercial, whether it's Medicaid, whether it's folks who have no insurance, we've got to figure out how to take care of the whole community.
Okay. So if I do have private insurance here, if I want to go to the medical village, you'll take it.
Absolutely.
Yeah.
Yeah, it is.
Okay.
Servicing the whole community.
Okay.
And the fact of its location, the proximity allows for that to occur because it is really centrally located.
Okay. Um, and that's this medical village is further down the road. We've talked about this before, right? I mean, you know, your first step is to get this Mary's Avenue thing going, right?
Yeah, the first thing, we submitted a certificate of
Yeah.
need application, and we're waiting for the state to review it. I'm sure they'll have some questions, approve it. Once they approve it, we'll start to get a shovel on the ground and get that moving.
At Mary's Avenue.
At Mary's Avenue, it'll
Right.
probably take us 2.5+ years to
To
do
get
that.
that completed. Okay.
In the meantime, we're trying to figure out how much virtual or how much even real medical village we could start to develop. Are there pieces of the Broadway campus that today we can start turning into pieces of the medical village? And that will get a jump on it, because we don't want to wait until the building is totally empty out.
Okay.
It won't be a full-fledged medical village, but there'll be pieces we can integrate
phases
today.
going along.
Yes. Mhm.
And one of those could be early on the education pieces.
Right.
So as we start looking at developing a simulation center or a community learning space, so we can develop some of the curriculum and pathways with the high school and the county college, that'll give us some ability to begin doing that while Mary's Avenue is being developed.
What is that simulation center? What is that?
The simulation center, as you begin to look at the skill set necessary to train professionals, medical professionals, it's a space where we have interactive high-tech mannequins, all different shapes
cool.
and sizes,
Alright.
and you can run different scenarios, whether it's CPR, delivering a baby. You can run various types of scenarios so that medical professionals can practice their skills on
On these
mannequins.
robots or mannequins.
On mannequins.
Yeah.
In addition to that, as more medicine becomes remote, so as we start looking at e-health and telemedicine, we can begin to set up cameras and work with care navigators and other types of practice.
So it's kind of like
Practitioners.
real life simulating
Scenarios,
real life stuff.
Absolutely.
Picture a mannequin that is hooked up to medical devices, and the computers can control the outputs from the mannequin. So, for instance, sharp decline in blood pressure.
You
So
can
the
switch
students will
on
be-
something and the mannequin will get a
What would you do?
Yeah.
To the students? Or a heart rate that is abnormal, what would you do?
but they can make the mannequin's heart rate
Correct.
abnormal.
Yeah.
Yeah. Oh, that's cool.
It's a great teaching tool.
Yeah.
So we're excited.
So, and
about
that's
it.
mostly for like paramedics or firefighters or.
It could be for those, it could be for nurses, physicians, it could be, it's really limitless in terms of who can use it.
Okay. So, and is this a way also for the hospitals? You know, hospitals are always in need of money, right? And you guys are getting a whole lot of it, I guess, from the state, 88.8 million.
88.8 million.
Yeah. There's two questions I have about that. A few years ago, before you guys were here, I mean, we went through this. You know, we built a $12 million, emergency room at Kingston Hospital, and I know it was before you guys were here, but people thought at that time, okay, that's it. Now we're good. You know, now we want to close that emergency room and build another one, right?
Yes.
At Mary's Avenue. How can you reassure the public, I guess, that this 88.8 million of taxpayer dollar money, plus some more that you guys are throwing in along with Westchester, right, is gonna be it for a while? I mean, we're done.
So we'll never be done in terms of improving the quality and the technology of care that we provide in the hospital.
Okay.
But let me just draw a contrast between the two. The original money that we received from the state came with mandates. The state imposed upon us. 2 hospitals, you will work collaboratively under one
That's
corporate
right.
member, number 1. And number 2, you will retain the mission and identity of each hospital. So Mary's Avenue was to remain Catholic,
Right.
and the Kingston Hospital was to remain secular. So
Right.
those were mandates. And you will have, each hospital will have 150 beds. So those mandates were given to us, and we were given money to accomplish that.
At that time.
So it wasn't by choice, it was by mandate. Over the next 5-6 years, the sisters, the Benedictine sisters, did give up their sponsorship of the Benedictine hospital.
Right.
It's no longer a Catholic hospital. And as a result, it allows us then to go to this next step. That 8 years ago or 10 years ago, when this was being thought out, 300 beds made sense, but only 200 make sense now. We're changing the way we deliver care. So we can't be static. We always have to be willing to be flexible and to change depending on the needs of the community. And that's what we're doing.
Okay. And also, like I said, it seems to me that the hospitals are always in need of funding. somewhere or another, the medical village, the people that will occupy that will lease the space from you, right? I mean, they're
Well,
gonna make payments to you
correct.
as far as, is that a way for the hospital to try to increase its revenue as well?
No, I mean, we're looking at it as a benefit to the community, and so from our perspective, we just don't want it to cost money. So there's a cost to having a building, and
Right.
nobody wants a closed blight on Broadway. So
Right.
if we can develop the medical village and have enough essentially lease income to support the infrastructure, the snow plowing,
So
the
it's a break-even
landscaping,
thing.
it's a break-even scenario for us. We're not looking at the medical village as a money-making scenario.
Okay. Okay. So you just wanted to, I mean, because hospitals don't pay taxes, right? I mean, you don't pay
No,
correct,
property
right.
taxes. Okay.
And so far, the community folks that we've reached out to are very excited about this. They think it as a, see it as a great opportunity for us to work together with them. So we're excited with getting forward on this.
Okay. And like you said before, that the medical village may be a phased thing, right?
Yes.
The educational component might be in there, simulation center might be in there before, Mary's Avenue project gets completed,
Right.
right? So kind of parallel
Yes.
thing. I think at one point, maybe at a chamber thing, you said that both of these are expected to be done in 5 years.
Yes.
Okay, so
Really
that still
start to
stands.
finish, head to tail. There'll be major pieces that are done concurrently, but you're right, probably 5 years all in.
And this has always been an issue with even before you guys, but employing doctors or physician or people to work at the hospital has been difficult over the years. Is it still? And will these do you think these plans for the medical village as well as the expansion at Mary's Avenue do something to help you with that?
I think our ability to attract doctors and other caregivers is really a combination of many factors. Those are important, but probably the most important is the affiliation that we now have with Westchester Medical Center, WMC
right.
Health.
Right.
Because, look at it from a physician perspective, the fact that now we are part of a 10-hospital system with WMC Health brings a lot more, importance to us and stability to us, where a physician will look at us and say, you know what, they're going to be around for the long term now.
Because they're part of this 10 hospital thing.
Right.
Yeah.
Now you've got state support for what we're doing in terms of the $88.8 million, so they embrace our vision. WMC Health sees the world the way that we do and vice versa. So they are all about doing medical villages and doing care coordination and population health management. So when a physician comes to us, they're seeing not just us, but everybody in the WMC Health family. So whether it's the Charities Hospitals, Bon Secours down in the Suffern and Rockland County, if it's Mid-Hudson Regional in Poughkeepsie, or if it's Westchester Medical Center and the Maria Ferrer Children's Hospital in Valhalla, we're part of a family. And I think that brings
And they
a lot
notice
of
that.
They absolutely do.
So what has been what have they why have they not come or you had trouble recruiting in the past?
I think there are a couple of reasons. The first reason is there is a shortage in certain specialties. So let me give you the example that is absolutely glaring in this community.
Yeah, what is it?
And in Westchester and in the state, psychiatrists.
Okay.
It is incredibly difficult to recruit a psychiatrist, again, not only here, but also in Valhalla and throughout the state. So number one, shortage. Number two, you have a profound need. And I'll give you the example, which again is the most glaring, is up in Delaware County, Margaretville Hospital. Delaware County has the highest teen suicide rate in the state and has no psychiatric care.
Oh, that's interesting.
That's terrible.
No psychiatric care at Margaretville Hospital.
We've occasionally a psychiatrist has come in, but the adolescent population there desperately needs healthcare providers. So how do you then take tremendous need and then partnership to be able to do something unique? That uniqueness is done through telehealth.
Through what? I'm sorry.
Telemedicine.
Okay, what is that?
So picture a screen similar to your computer with a little robot on top that looks like R2-D2, a miniature R2-D2.
Yeah.
And it allows communication and interaction between the patient and a caregiver at a remote location. So think about a psychiatrist who is Valhalla based, speaking to a adolescent up in Margaretville and providing care.
But he's somewhere else.
He's somewhere
He's
else.
not
He's
he's not at Margaretville
Correct.
Hospital.
So you're linking scarce resources to need through telemedicine. And WMC Health has developed a very, very large, what they call an e-health initiative, where they're doing telemedicine for
So
many
they're already
specialties.
doing it
They're already doing
at
it.
some of the hospitals that they
Correct.
have.
And to show you that it works, they rolled out the outpatient mental health piece of it at Mid-Hudson Regional Hospital, and the no-show rate for the outpatient population they serve dropped from the 30% category to less than 10%. So the patients are
So
embracing it.
we kept them out of.
We've kept their appointments. People actually made appointments and kept them with their caregivers.
Okay.
Via
Kept them,
telemedicine.
okay. So it's not just psychiatrists.
Well, in this program, it is psychiatrists, but we're going to be doing it in ICU. We're going to be doing it in our maternity unit. We're going to be doing it for stroke protocols. We're going to be doing it in the emergency room. Anywhere.
So expanding the psychiatrist telemedicine thing that Westchester does now,
Right.
to include other
specialties.
specialties.
So if a patient came into the emergency department or the ICU and you wanted another set of eyes to look at something that maybe you don't see every day as a caregiver, you can call up the physician in the Valhalla campus. They can come on the computer and actually observe the patient and help the caregiver who's on the ground here.
Tell them what to do
provide
right
care.
on the thing that they could be home.
And collaborate with them. Correct.
Yeah.
That's a very powerful tool.
I'm surprised that hasn't happened already.
It is. It's up and running.
Oh,
It's
it
up
is.
and running,
It is.
Oh, you have one now?
Westchester has an entire
Okay, Westchester does. I mean, but this.
Right now we
e-health
are.
center.
Yeah, they have a big e-health center. We are right now just getting the equipment that we need. Protocols are being established,
Okay.
and we'll be rolling this out very soon.
But it's not
Uh,
theoretical, I guess was what I'm saying.
It's
They're currently doing it, and
They're currently doing it. Yeah, I get it. But I mean, you guys are yourselves aren't doing it yet, but you're gonna latch on soon,
Very
right?
sure.
I mean, that would be
Right.
fair to say.
Yes.
Okay. How long do you think that would be? Like a couple of months from now?
Yeah,
or
we will be operational in the next month or two,
in the next month.
and it'll continue to expand. So that's a tremendous benefit of having an affiliation. People see affiliation as, what does it mean for this community? It brings technology and it brings caregivers.
And this
that
is
we
one
don't
example
have.
of that,
This
right?
is a great example of that.
Yeah.
So we're very happy.
Because most people think they got together because they need money, but
No.
this is this.
You know, and that's a great segue, because a lot of people see Westchester Medical Center, WMC Health, as, are they going to take business away from this community? And it's just the opposite. Their goal is to keep local care local. They want to keep community hospital care in community hospitals. The only thing they're interested in doing is, when you need a level of care that really is outside of our domain, then to be able to transfer that care to WMC. That's what makes
Yeah,
sense.
like when I guess I mean, but you've done that before, like
We have done that
people go to Albany.
So for high-end cardiovascular, for
Right.
burn, for children's diseases, things that we should not be providing as a community hospital, that should go to the Valhalla campus.
Things
Everything
you
else
can't
should stay here.
provide, right? I mean, you can't
Not only
provide.
can't,
those
but should.
shouldn't. Right.
shouldn't.
But
Why?
shouldn't.
Why? That's strange to me.
No,
Why not? Shouldn't you provide, say, children's services?
because it's really, number one, it's too expensive, and right now, children's services are only provided regionally because of the cost and the level of expertise
Right.
that you need. So that expertise is concentrated in one facility. It just makes more sense to drive the care there.
Paul,
And
when you
go
have a child that comes into the emergency room and needs to be admitted to the hospital, nowadays that means the child is very sick if they have to be admitted. And if they're very sick, you have to have the full range of services. So you might need a pediatric oncologist, a pediatric cardiologist.
You don't have all this.
Each of those subspecialties, you need a lot of pediatric patients to keep those physicians
I
busy.
see.
And so that's why across the country, you're seeing this regionalization of pediatric services to children's hospitals. Valhalla has one of the best.
And also when it comes to transplants, community hospitals do not do transplants. You need a teaching environment, you need a tertiary quaternary center, and that is Westchester Medical Center.
And
So
small
the-
community hospitals, it's just can't do it, right? I mean, it's
Cannot.
it's not affordable. Is that basically what
Correct.
you're saying?
Correct.
Yeah.
We should be delivering what we call routine care locally, because we can keep the quality at the highest level and the level of a tertiary hospital like Westchester Medical Center, but we can do it much more cost effective than they can.
And with the eHealth Collaborative, now you have a network that starts, for example, at Margarettville, which is a small critical access hospital, right? It's 15 beds. It provides just immediate critical care.
So, yeah.
And then you have a community hospital like us. You have level
Right.
1 trauma and level 2 trauma with Mid-Hudson Regional and
Right.
Valhalla.
Right.
You have the full continuum. So with eHealth, we're able to keep folks local where it's possible. And if not, try to keep them within the system.
You mean the computer thing? When you say e-health, that's the you're referring
Telemedicine.
to- Yeah, telemedicine.
Yeah.
Okay. And so Margaretville, when you talked about the teenage in Margaretville, so in a couple of months from now, you think
We'll be introducing.
you'll be introducing it, and those kids will now be able to dial up a psychiatrist and talk to him on a computer.
Through the hospital, that is correct.
To the hospital.
Yes. So we think that's great. So what it does is it connects the behavioral health services we have in Kingston with our hospital, both inpatient and outpatient, the technology and the physician component of Westchester, and the need up in Margaretville.
And,
That's
and
exactly what affiliation should do.
right. And that's the only way you were able to do this with this affiliation. Otherwise, if this affiliation never happened, you wouldn't even be
We're
thinking
not
about
be able
this,
to
right?
do it.
Okay. So, and with the telemedicine, you still got to set up appointments, right? You got to be.
Yes.
I set up one for 11 a.m. today, right?
Correct.
So I got to sit there in front of the computer
You do.
at that time, and
That's
then,
correct.
and then I
Yes.
hook up with the guy
On an
right?
outpatient basis.
On an outpatient
If
basis.
you're a patient
right?
in one of our beds and you need a specialist, we
Yeah.
have the carts and we can roll it into your room and call up the specialist right there.
Oh, you can.
Yes.
So say there's a patient in the Broadway campus for a medical issue and they're being treated, but they need a psychiatric consult. You can bring the machine into the room, connect it with a provider, and do this.
Even though the guy's not there and he's not in the hospital. Do you
Now,
have
the state-
psychiatrists working in Kingston?
We do, but it's a
not
struggle to
HealthAlliance.
keep them.
It is.
But yes, we do have some. By the way, the state, and really this was with a lot of the leadership that came from WMC Health, the state just approved to be able to do inpatient telepsychiatry. Outpatient has been approved in the past. There are new rules and regs that allow it to be done on an inpatient basis.
Oh, that's
So,
recent.
yeah, so we're going to be one of the first to do that.
To do it
Inpatient.
inpatient.
So
So
we're
Westchester
excited.
does not do that now. The inpatient
The
thing.
rules are just being finalized now.
Oh, okay.
Yeah.
So the health department has to approve these rules, or is that the way
Yes,
it goes?
correct.
Yeah.
Okay. The Mary's Avenue campus will include, I guess, we talked about this, a new emergency department, right?
Yes.
And it will also include, I've been reading this tower.
Well, we
the
affectionately call it the
five-story
tower.
or- yeah.
Yeah.
So what's going to be in there?
So the tower will really have two components to it. There'll be in essence, a one-story emergency department that's around 25,000 square feet. And then somewhat adjacent and on top of that, not totally over it, but somewhat adjacent to it, will be the 4-story tower.
Yeah, now,
That will include an ICU and 2 med-surg floors,
to what?
medical surgical floors.
Oh,
So we'll have new patient rooms. Those
Oh,
are
new,
patient
oh,
rooms.
those will be the rooms?
Yes.
Oh, okay, there's 100 and, well, I'm
Well,
at 200,
201 beds,
201
but
beds.
all the medical surgical beds will be private.
Oh,
So this
so
new
all the medical
tower-
surgical beds will be in the new tower?
No, they'll be in both the existing hospital and in the tower.
And
So
in
they'll
the
be
tower.
brand new and they'll be renovated. The
Okay.
renovated will be converted from 2 patient rooms to a single patient room.
Okay,
We think that's a very, very important factor from a patient satisfaction point of view.
this may be impossible to answer, but when do you think that the state health department would send word on the certificate of need?
It usually takes a couple of months. It depends on the number of questions they have about our application. Our application includes financial projections, architectural renderings, programmatic design. We're hoping for expedited approval, but it's really hard to predict.
Have they sent any questions back yet? or
They have not, but
haven't-
in general, we speak to the Department of Health quite often with WMC Health. They're very, very excited and they're very supportive of our project.
The health, well, yeah, I mean, they gave you
They gave
$88
the
million, right? You would think that they
Right.
would, that there would be no problem with the certificate of need.
And they're working hard because all of the folks who receive
Right.
funding through this initiative, many of them have to submit CONs as well. So there's this big push of CONs going through the system right now, in addition to the regular ones being submitted.
Yeah.
So they're obviously, there's a lot of work on their plate, but they've committed to try to get those completed and reviewed as soon as possible.
So there are two levels of approvals that we need. We obviously the Department of Health, as we just spoke about, but we also need local approvals. So
Yeah,
we are
planning
going
board
to the
and all.
planning board. We've been talking to the mayor quite often about our plans. Most of the local issues revolve around parking, water mitigation.
Yeah, that's what
traffic.
they usually deal with.
You want to make sure from a safety point of view and an access point of view, we're doing the right things.
Now, there is still, there's a helipad, right, over at Mayor's
There is,
Avenue?
Yes.
And will there still be there, will that still be there under this plan?
There will be access for a helicopter. We have not figured out the final location of that because we're trying to position the building, make sure there's enough parking. But helicopter can be very flexible about where they land.
Right,
So you can either do it as a designated helicopter pad, you can do it on a piece of grass that has no obstructions. You can do it in a parking
so
lot.
it's still gonna operate one
It's
way
still
or the
gonna
other?
operate, yeah.
Okay. Okay, so let me, go ahead, you want to say?
No, I'm just-
Okay,
I
sorry.
have a little bit of, and I apologize for
Yeah, no, it's
drinking the
all right.
tea. I have some laryngitis, so every
Yeah, I
once
can
in a
tell.
while it gets
Okay.
a little.
All right, so let me get to I get this one question, we asked people to, send me, questions, to my email directly, and we got one. So this is, I'm just gonna read it to you and you guys respond. The new complex should provide every Ulster resident the ability to use the facility. All tax-paying residents pay for the, police escorts, snow plows, to clear roadway for, um, clinicians and hospital staff and much more. Will Hudson Health Alliance resolve their issue with Empire Health and United Health to allow the affected plan holders to have access to the hospitals? This has been an ongoing issue.
It's an ongoing issue.
Do you guys see any resolve in sight?
I think there will be resolution. The question is, how long will it take to get this resolved? Because it is a legal issue. This isn't a negotiation between two parties. It's a legal issue between WMC Health and Blue Cross.
It's in court, right?
Has been filed as a lawsuit.
Yeah.
We hope it does get resolved because you're right. The people who are being impacted by this negatively are the people in this community who, for elective services, have to seek another healthcare provider.
And a lot of them are, I'm told, are public servants, right?
Many of them are county and city employees, folks who work in the local schools. So if they need emergency care, they can still come to our facility. But if they need elective care, then they need to go elsewhere. And
Okay.
That's unfortunate.
But it looks like this is going to be resolved through the court system. It isn't going to be something that you guys agree to.
Well, the two parties could get together and resolve it outside of court, and that's the preferable way to do it. But if that can't be done, then it will be resolved in court.
Yeah. Okay.
But we need to do it. From our perspective, the sooner we get this resolved, the better off we'll be.
Right. Okay. Okay. I guess we'll wrap it up because we're coming up on like an hour. You guys have been here. I mean, if you want to summarize what your plans are, I mean, you talked about it pretty much in detail here, but
I think from an overview,
Yeah.
the one thing I've been telling the community whenever I'm out talking is that we want to be an integral part of the community. We don't want to be a building that people only come to seek us. We want to be outward facing. We want to be part of the fabric of the community to make this community better, because this is about economic development. When you think about the investment the hospital is making and the investment the school is making on Broadway, we're talking about $250 million. That is a great economic boost to this community.
you mean in total?
In total,
Yeah.
Think about that. How often do you invest $250 million in a community such as ours?
Mm-hmm.
So we want to be part of the revitalization of this community. We want to be the driver and the reason that people bring business here to create jobs. And we want to be a good partner.
Do you think, I'm sorry, I'm just, when you
Mhm.
say stuff, it kind of triggers something. Do you think, with these expansion and the creation of the medical village, that there will be jobs created for people within, HealthAlliance fold?
I think there will be, and as Josh described it before, that medical perimeter. As you move care from an inpatient setting to an outpatient setting, the outpatient providers have to grow and expand. There's no other way to do that.
You mean the outpatient providers that will be in the medical village?
Correct, ourselves included, but also other providers.
Or elsewhere in the community.
Family
So as you look
Institute.
up and down the Hudson Valley, right, usually at the top of the list in terms of job growth is healthcare. And part of that growth will be in our own community, and part of it may be elsewhere in the county or in other locations. But I
Right.
think as a pillar of this community, the hospital and HealthAlliance and WMC are looking at it saying, okay, how can we help everyone lift the entire, all boats rise?
Right.
And the best story we've had so far is one where a local high school student whose father is an orthopedic surgeon in this community for years, he went off to college, he went to medical school, he did his residency, and he chose with his family to come back to Kingston and become a general surgeon here.
Oh, cool.
Yeah, Michael Moskowitz, which is a really nice story. Man,
Yeah.
that's what we want to do. We want to help kids who are in college see the future. If it's in medicine, go out, get your education, get your experience, but then come back to your community.
Come back
This
to
is a
work for
fabulous
us,
community.
right?
Yes.
Hmm.
Yes, we want to be that link.
And there will be educational centers in the medical village that will help
Correct.
high school and college bound kids do that.
We
very
mentioned
simply.
New Visions before with the high school. I just finished talking to the Boy Scouts who want to put an Explorer post in the hospital. Again, another exposure.
We met, sorry, I was gonna say, we met with P-TECH, as part of an extension of the high school and now at the county college, about creating a health IT pathway for the high school students. So, I think there are a lot of opportunities with that walking distance being so close to be able to create classroom environment and in a clinical or lab environment where students can rotate through and get that exposure early on.
And you got to start signing people up for this soon. I mean, the providers that are going to be in the medical village. Sounds like you got ambitious plans. It's only, 5 years seems like a long time, but it's really not. I mean, you got to get clients, right, or ECs.
Yeah. So where we are with that process is we're now sitting there now that the first CON has been filed and submitted for Mary's Avenue.
Yeah.
We're working to put the plan together so that we can submit the next CON before the end of the year. And
For the medical village.
For the medical village. And to your point, part of that process is looking not only internally about what services HealthAlliance would like to locate in the medical village, but also who are the community partners that would like to potentially rent space in that campus.
Yeah, so you gotta have an answer for them, right? The health department, that you got people that are very interested
Sure.
and lined up to be in there, because if you submit documentation that has, well, we don't know, we don't really have anybody, or
Right.
that may not be accepted by the
And
health
we've
department, right?
already developed sort of a core group who has expressed early interest over the last 2 years.
And
We've
Family
now-
Institute is one of them.
Yes.
Yeah, absolutely.
Okay, so they're like the anchor.
Yes.
They would
absolutely.
be like the anchor.
Yes,
tenant.
absolutely. And they're already on that campus. I think the opportunity for them to expand their space to begin to integrate behavioral health and primary care and other services is going to be huge for us and for them and for the community.
What again? It's just triggering things. I know I was.
We'll
I
need
said,
another hour.
I said 10 more minutes and wrap it up. But so in that medical village, though, besides Family Institute, what kind of other practices do you think will be in there? You mentioned the educational component already, but what other kinds of things? I think you even mentioned yoga.
Yeah, there can be yoga, acupuncture. Think of a green market. Think if you can bring produce from the surrounding communities into the medical village.
Yeah.
Use the kitchen possibly for demonstrations of how to cook,
Right.
access for people to buy it, government services, senior housing, jobs.
Yeah, and there are other community-based providers who maybe offer, who are not-for-profits, who maybe offer behavioral health services or others who believe that being co-located really has a benefit for their clients.
For their thing.
Home care services, long-term, short-term.
Mm-hmm.
There are endless possibilities.
And our own
All
outpatient
having
services.
to do with you're not gonna get Radio Shack in there. I mean, this all
Well,
has to do
it's a-
with
Health.
medical,
Yes.
health.
Healthy living.
Yeah.
And healthcare in general.
Health and wellness, yeah.
Yeah.
But you're joking, but in some ways, yeah, you could have a healthy food shop, cash and carry. You could have a pharmacy.
Your pharmacy.
That has to do with health.
right,
I mean,
you know-
I'm talking about you're not gonna have somebody who just wants to rent space and sell,
No,
Electronics.
no, I don't. That's not the
Yeah,
mission
right.
of the building.
Yeah.
Yeah.
right. And so all these things will fit the mission of the Healthy
But-
Neighborhood Initiative. and
But the
that kind of thing.
purpose is, and again, to receive funds under a value system, you want to make sure that the folks who are working with you truly have a positive outcome on the people that you're taking care of. So health metrics have to improve.
So the state's gonna wanna see that,
They're gonna wanna
right?
see it.
They're gonna wanna see that
They wanna
because
see
they're
proof.
giving you $88 million, so they wanna see that you're doing what this program that they established, right?
That's correct.
Wanted you to do.
And we're going to be
right?
submitting
And
data to
you
the
mentioned what's the name of that program again?
district.
Yeah.
Yeah. So, and we're going to be submitting. We do now submit data to them on a quarterly basis so that we can begin to measure the outcomes and performance of those projects. Westchester, being the lead for our area, has invested interest in really helping us develop these programs and is working with us on a daily basis to do that.
So we think that we will submit this a request, a certificate of need, request for approval by the end of this year on the
Yes.
medical village.
Yes.
Okay.
And remember what district stands for, because a lot of times we use
Yes, that's
we
right,
use
yeah.
acronyms that everybody goes, what are you
Yeah.
talking
What does it
about?
stand for? I
It's
forgot.
delivery system,
Yeah.
reform,
Yes.
incentive.
Okay. And this
Payment.
medical village fits that. You guys believe that title.
That's right. We are going to reform the way we deliver care, but there are incentive payments attached to that change.
Okay. And it's all about. I mean, the bottom line is trying to prevent people from going to the hospital. Right.
Yes.
Yes.
Sounds like a strange
I was just gonna
initiative for
say that
CEO.
is-
You got to get your head wrapped around it.
Yeah.
I sometimes I kid with people that I speak to that we would be wildly successful if we closed the doors of the hospital because everybody was healthy.
Yeah.
Imagine. That's
Right.
our goal.
Right.
Attainable? Probably not. But
Right.
how deep into that could we get?
There aren't too many businesses that try to put themselves out of business.
Right. Well, that's true.
Yeah.
But you're right. It probably will never happen. Just like some people, there should be no crime. Well,
Right,
yeah, there
right.
shouldn't be. But it's not
But
reality.
how close can you get to that end goal?
Right.
And we want to be there for those that really need to be in the hospital. I mean, that's the end of the day. You still have to have
And
those services.
even if you this medical village and that concept prevents people from going to the hospital, do you truly believe that maybe one day you can shrink that number of beds from 201 to 100?
It's certainly possible. Yeah.
Yeah.
That's something. That's why I said before, we need to be flexible. That's the reason. If we can change outcomes and improve health, maybe we do get smaller. But that's good. Partially the reason that's good, we're reducing the cost of healthcare. One thing everybody rails about is healthcare benefits and insurance is very expensive.
Yeah.
If we can be somebody who can reduce those costs, this becomes a very attractive place for businesses to move into.
So
Well,
when
Paul,
you say reduce those costs, all right, I'll just use me as an example, right? If this happens and you reduce the cost, like you're saying, let's say it becomes smaller. 10 years from now, there's 100 beds, and I pay so much a month in insurance, right? For my insurance, right? Does that mean you reducing your cost? Does that mean my insurance costs will go down?
It could, depending on how we craft plans. And I don't want to get to go down that rabbit hole because that'll take us another hour to go through.
Okay, yeah, that's
But
fine.
in a sense, the hospital could offer an insurance product because the quality is high and the cost is low and delivered to you at a lower premium.
But this isn't theoretical. So think about a good example, and I think I've heard Dave use it in the past, is a mom delivering a baby. Right? Back in the day when you delivered a baby, maybe you stayed 5 days
In the hospital.
in the hospital.
Mhm.
And now that same stay is a day or two.
Right.
That is a reduction in costs. At the end of the day, the insurance company isn't paying for 5 days of stay.
All right.
And it's the same outcome for the mom and the baby. It's not like the outcomes are worse. The outcomes in some cases or in many cases are better.
They don't stay as long because the technology is better and that kind of thing.
Right,
I
or
mean,
some of the
that's why they don't-
surgeries that were done and you stayed overnight or a couple of days and now
Yeah.
it's the same day.
Yeah.
That's a reduction in cost.
Yes, okay, I see that.
So our job, quality as high as we can get it, adopting best practices from WMC Health and member hospitals, and reducing cost.
Okay. Where was that other one? Well, I'll listen to the tape, but that other hospital you said was doing a medical village?
In Port
on
Jervis.
Port Jervis.
Yes.
Is that what it's called?
Port Jervis is the town. It's part of the Bon Secours system.
The which one?
Bon Secours charity system.
Oh, okay.
Good Samaritan
Good-
Hospital.
Good Samaritan Hospital. That's the campus it's on, the Good Samaritan
No,
Hospital?
the campus is in Port Jervis.
Okay,
So there's 3 hospitals: one in Port Jervis, one in Warwick, and one in Suffolk.
okay, but the one in Port Jervis is the one that has the building on it.
Yeah,
that
they're
was-
the other medical village within the WMC Health family.
Okay, and then you said there were 10 others.
No, there were I believe at the
That-
time I looked, it was roughly 20
Oh, that
across the
applied.
state that applied for the medical village project.
But only you and this other one in Port Jervis are doing buildings.
Yes, at that time.
Okay.
And that might have changed, but the last time I looked, we were the most substantial.
Where do I look? Can I look? Can I go see?
Absolutely. Yeah, Jerry can give you the link.
Okay,
We have that. It's all on New York State Department of Health website. All of
Okay.
that's publicly available.
okay. All right, cool, guys. Well, thanks very much for coming in. I think we learned a lot. I know I did. Hopefully our viewers did as well. But I want to, the Freeman, I guess, wants to thank Josh Radner, who is the Chief Strategist for HealthAlliance, and David Scarpino, the CEO and President of HealthAlliance, for coming on in and talking to us for a
Yeah,
little
thank
while.
you for the
Thank you.
opportunity. I think this is a great format, and maybe in the future we can
We'll
do
do it
some
again.
more as issues come up.
Yeah.
We want to make sure the public understands what we're doing.
We'll get it done.
Great.
All right.
Thank you
Thank
very